Hey, and welcome back to LW Pharmacy Technician School channel. My name is Lindsay. I'm going to be your host for today. This is part 2 to the medication video we started last week. Make sure you have your paper and pen because we're dropping gems this entire video, okay? This is medications part 2. Remember, we do drop new content every Sunday, so make sure you subscribe and ring the bell for more information, okay? Let's jump into it. This first slide is talking about medication side effects. It says, which of the following medications will discolor the urine? So when we think about discoloration of urine, that also helps us to know that the medication they're talking about could possibly be used to treat the urinary tract system, right? So that means that we want to think about medicines that can be used to treat that particular body system. I know a lot of us know about AZOs. I know I do. AZO is an over-the-counter medication that can be used for UTIs. So when we look here, we want to think about what medication could possibly be used to treat UTIs. I know that amoxicillin is an antibiotic, but it's not used to treat anything that is for the urine, right? And so then what you can do is start to go through these multiple choice and fade out what you know does not apply to the question. And then the other thing we can do, because you know we've been on this keyword highlighting binge for a while. Let's highlight our keywords so we can ensure that what the author is asking, we are understanding and receiving. Okay, so it says discolor the urine. Well, when I look at the image, because y'all know I always give y'all a hint, when I look at the image, it tells me that this is AZOs. And then at the very bottom here, it's telling me that it is letter C. Okay, letter C is going to be the answer. And if you look down here at the bottom, it gives us the generic name or maybe even the generic name, and then the bottom says hydrochloride, right? So AZO is that brand name that we hear all the time. We hear it on TV, we hear it at the doctor's office, but then the generic name behind it is going to be letter C, okay? Write that down. Make sure too that you are subscribed to the channel so you can get more information. We post every Sunday. Now we're going to talk about drug class. This is going to be on your test, so write this down. This slide right here is pretty important. Proton pump inhibitors. When I think about proton pump inhibitors, I immediately think about the stomach because I think about when people overdose on medication or overdose on drugs, how they sometimes have to get their stomach pumped, right? Pumped. That is pretty much the only part of the body that we can do pumping on. So when you think about proton pump inhibitors, I want you to think about the digestive system. Proton pump inhibitors is also known as PPI. Write that down. PPI is also known as proton pump inhibitors. What is it used for? It is used to treat GERDs. Used to treat GERDs, right? And it says that the proton pump inhibitor drugs are Prilosec, Zantac, Nexium, and Prevacid. Prilosec, Zantac, Nexium, and Prevacid. Okay? Those are all brand names that you hear on commercials. You hear them, they're OTC. You can buy them over the counter. But when we think about drugs that may be prescribed to, individuals, sometimes their suffix ends in P-R-A-Z-O-L-E. P-R-A-Z-O-L-E. Write that down. Prazole is a suffix for proton pump inhibitors. So anytime you see Prazole, P-R-A-Z-O-L-E, a lot of times it's going to be your answer when they're asking you about drugs that are used to treat GERDs and drugs that are classified as a proton pump inhibitor, okay? Sometimes it's not about trying to remember every drug, but it might be more so about trying to remember the prefix, infixes, and the suffixes, okay? I have an ebook that's gonna help you remember those prefix, infixes, and suffixes, and I'll drop that book in the comment. or in the description of this video. So you can go and you can start to remember this information, and it'll help you. It will really help you remember the top 200 drugs. Because remember, you don't always have to make it to where you're trying to remember all these drugs and you're studying this information. No, you don't have to do that. Generic name. This is going to be on your test. Brand and generic is on your exam. Which of the following medication is used in the treatment of glaucoma? Remember, we're talking about keywords here. Treatment and glaucoma is your keywords for this particular question. Glaucoma is a disease or a condition that affects the eye. Okay? It's a disease or a condition that affects the eye. When you see the word ophthalmic, you know that we're talking about the eye. Okay? And your answer is going to be C. C is going to be your answer. Clap it up for Zion. Let's go, Zion. Let's go. Zion is a freshman at Prairie View A&M. And she has, taken this program, and she took the 4-week class, passed the class, and is moving into her career of pharmacy. And I'm just so proud of her. I am so proud of her. She says that this course allowed me to dive more into pharmacy and taught me all the things I needed to know about becoming a pharm tech. Okay. Now, y'all know my videos are not just for pharm tech. Also, we help nursing individuals who are, studying for the nursing exam, pass their test. We've helped individuals who are studying pharmacology, become more successful in that area. So this is not all about pharm tech, but it's about pharmacology, medication, healthcare in general. And we love to see when our young students take it to the next level and pass their board exam and become certified in whatever capacity it is. But we know that we're helping them to do that, okay? Y'all say, go Zion in the bottom. Tell her in the comments so she know that it's real. Now, let's look at the drug classifications. Drug classes is on your test. Yes, it is, honey. Drug class. Which drug class would be used in treating herpes? Let's think about herpes for a second. You know what? I'm going to say this, and look, don't judge me on this, but I know if y'all keeping up with the culture, y'all saw something about like Keke Palmer going to the Usher residency in Vegas, and how she was having a good time with him or whatever, and I guess her baby daddy got upset about it. And immediately people began to talk about Usher allegedly has herpes. And, now when I see this word herpes, I can't do nothing but think about Usher. Again, this is allegedly. I don't know if this is true or not. I'm just saying what I saw on the internet. And now I'm just like, Lord, every time I see herpes, I'm thinking about Usher. It's just a side note. Sorry, I got distracted. I hope, that it's not true, but, it is what it is. Shout out to Usher. I like his music. And I've always been an Usher fan since I was young because he's a part of the generation that I grew up in. Okay, shout out to Usher my way. But anyway, drug class used to treat herpes. So when we think about herpes, we know that it's a sexually transmitted disease, right? So that means that it is highly contagious. It is transferable. And they say that for herpes, there is no cure. Okay. They also talk about with herpes, people need to be careful because, even if you use a condom and if it's in the areas that are still touching each other, people can still get it, so on and so forth. So because of its contagious effects, we now can think about it as a what? A virus. Herpes is a virus. And because herpes is a virus, it's going to take an antiviral drug to fight against a virus. What else is a virus? The flu is a virus. COVID-19 is a virus, right? So when we think about virus drugs, remember that virus conditions, remember that antiviral drugs are used to treat viruses. Okay? Okay. All right, y'all don't be coming for me. Generic name. Here's another generic name. So now we're thinking about migraine headaches. You know what, y'all? Okay, so I had this implant in my arm. It was birth control because I have 2 children. So my youngest son, he'll soon be 10, and I had the implant in my arm, as birth control. And so when I first got it, I think he might have been 6 months or 6 weeks, something to that effect. So I went to the doctor, to my OBGYN, and they, recommended this implant. So I took the implant and put it in my arm, and it was supposed to be good, I think, for 4 years. I want to say for 4 years, somewhere around there. So the first 2 years, I'm on the implant, no side effects, nothing, everything seems to be fine. The only side effect at that time was I couldn't lose weight. Baby, I was chunky, okay? Chunky. And then, I said, okay, well, whatever, it is what it is. And then I started getting migraine headaches. The very first migraine I had, I did not know what it was because I had never had one before. But I remember being at my mother-in-law's house, and I hadn't eaten all that day, and I just remember having this headache and just feeling so sick to my stomach. So where literally I was laying on her sofa and I just was sick. And so I think I did take some medicine at that time, but still didn't really know what was going on. And then thereafter, I began to have, these migraine headaches. They were not very frequently, but they were here and there. But when they came and they would put me out. Towards the end, when I started having the migraines, I would get these flashes that I would see on the side of my, like on the side of my eyes. I would see these flashes, and it would just, pulsate like that. And at first, I didn't know what it was, but then I started to realize that every time I thought I would have those flashes, those headaches would come on. So, baby, I would be trying to hurry up and do whatever it is I needed to do because I knew once that thing got started, I was going to take some medicine and I had to just sleep. I couldn't do nothing but be in a quiet room and just sleep. And thank God for my husband because he would take care of the kids and everything. One time I had to ask my neighbor to go and get I had to go and get my oldest son at that time. I think I had to ask her. I believe I did, and she did. My neighbors were really nice. This is when I lived in East Texas. I live in Houston now, but at that time I lived in East Texas. And so they didn't tell me that migraines was as a side effect of, birth control. And so, anywho, took the implant out, and I have not had any migraines since then, and that's been over 5 years. So I thank God for that. But yes, child. So when I see migraines, I automatically think about my experience and what happened to me when I was taking birth control. But when you think about migraine headaches, you automatically want to think about triptan. Triptan is the suffix for migraine headache medications, triptan. Baby, it's like you trip in, okay? You got that migraine and you trip in. Now, when you got a migraine, honey, you are not turned up like this. But triptan is the suffix used to treat migraine headaches. It's going to be in those generic names. So remember, you can always find a suffix or a prefix in a generic name. A lot of times you won't be able to find it in a brand name, but you will be able to find it in a generic name. And also remember, just because it fits this drug doesn't mean it's always going to fit this situation, okay? Sometimes it's very situational. Pharmacology has a way of doing that, and that's okay. So don't get crazy. But when it works, and use it, okay? The generic name for diuretics that are often taken with potassium supplements. So if a diuretic has to be taken with a potassium supplement, that lets us know that that particular drug is doing what? Is depleting the potassium that the body is absorbing. So because it's depleting that potassium, we have to use a supplement to replenish what that medication is taken from the body. Baby, look, we're going to learn today and we're not going to make it hard, okay? I told you we dropping gems. Make sure you write that down. So a diuretic is used to get the fluid off of the body. And some diuretics are used for blood pressure because there have been studies that have found that blood pressure can be elevated by the fluids that are being kept on the body because those fluids may be high in salt, okay? And remember, if someone has high blood pressure and they need an IV, we're not going to give them normal saline because normal saline is salt water. We're going to give them dextrose water because dextrose is sugar water, okay? So if someone has diabetes, we're not going to give them dextrose water. We're going to give them normal saline because that person has high sugar, so we don't want to increase it and give them more, okay? Which of the following diuretics? So now we're thinking about something that's getting water off of the body, removing the fluid, okay? Thiazide, okay? When you see hydrochlorothiazide, hydrochlorothiazide is a diuretic that is used to remove the fluid off of the body. That word hydro here talks about water. Hydro is water. So we're removing hydrochlorothiazide, or excuse me, we're using hydrochlorothiazide to remove the hydro off of the water, off of the body, to remove hydro off of the body, okay? Hydrochlorothiazide is a thiazide diuretic. Write this down. What type of diuretic is hydrochlorothiazide? It's a thiazide diuretic. So you can just put both of these words, write both of these highlighted words down. They are not together, they are spaced. Thiazide should have a capital T, diuretic should have a capital D, okay? And remember, hydrochlorothiazide is prescribed to patients with high blood pressure. High blood pressure. We're looking at generic names. We're still here. It says, which of the following hypoglycemic medication is classified as a big drug? Baby, I don't know if I can say the whole thing, so we're going to say big. When you see this name, it's big. I done told you before, we don't get paid to pronounce the classification names, the drug names, any of that, honey. We get paid to make sure we don't cause no medication errors. That's what we're going to do. That's what we're going to focus on. So when we think about hypoglycemic, let's break that down. So hypo means low, because if your hypo is low, if it's hyper, it's high. You know, like when people was young, you know, you'd be like, oh, that child is hypo. That means they have high energy. Hypo means they have low energy. Hypoglycemic, glycemic is sugar. So hypoglycemic is low sugar, okay? So when we think about something that is used to treat low sugar, we're going to be thinking about metformin. Well, and it's not even just the fact that it's used to treat hypoglycemic, but it is the classification of this drug. And metformin is the only drug that is classified as a big drug, okay? Write that down. So anytime you see this word, you know that they're talking and speaking about metformin, okay? Adverse effects. Now, an adverse effect is an effect that is, because I get this question all the time, is the adverse effect and side effect the same? No. Side effect is just something that happens, right? So sometimes when people eat dairy, they may have a side effect that they may be gassed. They may be, you know, gas. But then there's some people who eat dairy who has developed lactose intolerant, and intolerance to dairy. They may become nauseated. They may become feverish. They may have chills. They may become very sick with diarrhea and all of these other digestive symptoms. That's not the same as a side effect. That is an adverse effect that we don't want. An adverse effect can also be life-threatening, okay? Now, I won't say that I've ever encountered anyone who had an adverse effect to dairy and they got, they passed away off of it. But I do know that there are some drugs out there that can have an adverse effect on people and they pass. I remember when ecstasy was a new drug, back in the early 2000s. Not a new drug, but it was a drug that people were, taking and participating in. And someone that I knew took ecstasy, and their very first time taking ecstasy, and they had a heart attack and died immediately at the scene, and they were in the club. Their bodies couldn't take ecstasy. That was an adverse effect of something, okay? So an adverse effect is life-threatening and very serious, can be very serious. A side effect is just something, that we know this could happen. Somebody take medication, they develop hives. Okay, that's not very serious. Take some Benadryl, stop taking the medication. Let's see what goes on from there. But if someone heart rate increases, their blood pressure drops very low, and now we're looking at, okay, this is an adverse effect and something is going on with this, okay? So remember, adverse effect and side effects are different. It says, which of the following medication, if used during pregnancy, may result in a birth defect? A birth defect could be where a kid or a baby is born with 9 fingers and 11 toes. It could be where they are born without an arm. Maybe they have something, where they just are not formed the way that 2 arms, 2 legs, you know what I mean? That sort of thing. So this is an example of an adverse effect, meaning that if a person is pregnant, we don't want them taking this medication, okay? The drug that may cause a birth defect when somebody is taking it while they're pregnant is letter C, isotretinoin. Isotretinoin is used for acne, okay? And it is a medication that people have to sign the I pledge paper when they pick it up, and they're pledging to not get pregnant. And they're also saying that, hey, I'm aware of all of the side effects that this drug brings. I'm aware of all of the adverse effects that this drug brings. And I'm okay with that. I'm willing to take the chances and still use this drug to treat and to cure whatever the issue is at that time. Okay, more so treat. Okay. And so when you think about I pledge, think about isotretinoin. If you notice, there's an I in I pledge and there's an I in isotretinoin. Okay. Generic name. Which of the following is the generic name for Lexapro? Lexapro is used to treat depression. And when we think about Lexapro, I want you to remember that Lexapro is the brand and the generic is letter B. Letter B. I want you to highlight Pram. P-R-A-M. Pram is used to treat depression. Okay, highlight that. And then also I want you to highlight or write down E-X-T-I-N-E. E-X-T-I-N-E, E-X-T-I-N-E. All of these drugs are used to treat depression, okay? And they're all SSRIs, which is the drug classification for this drug. And the only reason we're selecting letter C is because the question asks for the generic name for Lexapro. So even though all of these drugs are used to treat depression, they're not all the generic name for Lexapro. So your answer is letter B. But remember the prefixes that we want to highlight when we're thinking about drugs that are used to treat depression. These are drug suffixes that we want to think about. E or X-E-T-I-N-E, P-R-A-M, X-E-T-I-N-E, X-E-T-I-N-E, okay? Drug-to-drug interactions. This is on your test. Write this down. The effects of levothyroxine are decreased by iron. Iron will decrease levothyroxine. Remember, levothyroxine is used to treat the thyroid. So if someone is taking thyroid medication, they should not be taking iron pills because that will decrease the effects. This is considered a drug-to-drug interaction. That means that this drug is interacting with this drug and it's causing it to decrease. It's causing it not to do what we want it to do. It ain't giving what it was supposed to give, okay? It's not giving. So because of that, we want to make sure that that patient knows that levothyroxine will decrease or iron will decrease the effects of levothyroxine, right? So that means that that patient, if they're taking it, they need to let their doctors know, hey, iron, I'm taking it and I just want to be upfront and honest with you, okay? That is all that we have for today. I am so proud of Zion. I am proud of you, friend. I am proud of you for sticking to this even when it don't feel good. I'm proud of you for making sure that you show up for yourself every Sunday. Friend, you know I tell y'all all the time, study 30 minutes at a time every 4 hours. That's going to give you 2 hours of study time a day. You do not have to overload your brain with information to pass your exams, to become the person you want to become. Give yourself some grace. Love on you. Baby, make sure that when you are thinking about your success, you think about how you are treating your body. Because without this body, we can't do the things we need to do. So don't overwork yourself, okay, friend? It is Sunday. I have had a ball working with you today, and I'm always happy that I can be here with you, okay? Next Sunday, we're going to continue on our medications content. It will be part 3 to the medications. Make sure you are tapping in with your paper, your pen, and your highlighter because we are going in, okay, friend? Continue to take care of you. Do your very best, and I will see you next Sunday. Bye.